Stroke neurologists are a commodity right now in the United States. It's very hard to recruit a stroke neurologist, and I say that because I am the head of the division of stroke and cerebrovascular disease at my institution, and I've been trying to recruit 2 vascular neurologists over 2 years. We were able to recruit one, and then we're still recruiting a second one. And I hear from my colleagues that vascular neurologists are a hot commodity right now. They're very difficult to find, and that adds on to the burden of stroke care. So, you know, as you have heard, we're doing more and more interventions. Patients are being brought into comprehensive stroke centers and primary stroke centers for the management of stroke. So we will see more and more activity, more and more burden being placed on these specialists. The value is that they carry the expertise to treat and manage these patients in the hospital. So there's no question, right, that in a comprehensive multidisciplinary setting, you need a stroke neurologist to be the leader in a stroke program. Having said that, it still exposes a lot of the community and patients to being underserved because the availability of these experts, as I mentioned before, is limited. So can we train other providers to identify and treat stroke patients? The answer is yes, and I don't think why we shouldn't. You know, taking care of stroke patients, it's simple from the protocol or algorithm perspective. Once you establish a protocol and you follow it, the interventions are streamlined. So can we train non-neurologists? The answer is yes. We have partnered for a long time with our emergency room, emergency department colleagues, and even though it has been a rocky association because of the different ways that we interpret the data, it has been successful. So can emergency room doctors identify and treat patients with stroke? The answer is yes. And now more and more you will see that we can actually bring the expertise of the vascular neurologist to those providers that may not be trained in neurology. So I'm talking about telemedicine. So with the increasing use of telemedicine, we are covering and filling the gap for the community in terms of providing the expertise. Of course, the government and the guidelines suggest that a stroke center has to have the input of a stroke neurologist. We're not going to change that, right? But how can we improve or increase the exposure to the expertise? And the answer is with technology. So telemedicine is probably the answer to it. I'm talking about these jurisdictions, meaning the United States. I don't know how it is in different jurisdictions, how it would be in Mexico or in Canada, but I know that in those jurisdictions, telemedicine is also an important part for the delivery of stroke care when you don't have experts available. And it follows a model, for example, that we have seen also in critical care, where we have trained other providers in providing critical care for that first hour. That makes a lot of difference, right? And societies have implemented protocols and courses for physicians that are not intensivists that can actually increase the exposure to critical interventions within at least the first hour. And what we're talking about here in stroke is that these interventions are time dependent. So we have up to 4.5 hours, right? And I know that I've been saying we may have to extend the window for some other interventions using technology. You know, perhaps for that particular decision making, we can use telemedicine or train non-neurologists to participate in a protocol, in a multidisciplinary protocol. Sure.